Fentanyl is responsible for a rising number of overdose deaths in the state and is a leading cause of death for young Idahoans. On Friday, U.S. Attorney for Idaho Josh Hurwitt and Idaho State Police Colonel Kedrick Wills joined me to discuss how the state and federal governments are working to stop the influx of the drug into Idaho. Thank you both so much for joining us today. First of all, what is it about fentanyl that makes it so dangerous as compared to meth?
Its lethality and its addictiveness. It's about 50 times more addictive than heroin, and a 2 milligram amount of fentanyl is considered to be a lethal dose. And I brought a Splenda packet as a little prop, an unfortunate prop, because this is 1 gram of a sweetener. If this was fentanyl, or pure fentanyl, this would be 500 lethal doses. So if you think about the manufacture of fentanyl, it's unfortunately very easy to get small amounts into the country and around the country, and it's in pills normally, and about 6 out of 10 pills contain lethal doses according to recent DEA findings.
We know that between 2020 and 21, the rate of overdose deaths doubled in Idaho. And I know it takes a while for mortality data to become public and to process. But from what you're seeing, are we on the same trajectory with that overdose rate rising?
I believe we are. And what we use at the Idaho State Police to look at that is our seizures, because there's a direct correlation to how much drugs we're seizing to overdose deaths, which, by the way, is the #1 leading cause of death right now, which is very scary for all of us. And we are seeing, just a quick stat, in 2022 we seized about 65,000 doses of fentanyl, and so far in 2023, just the Idaho State Police, we've seized almost 200,000. So about 4 times what we've seized just a year ago.
And when you're talking about it being one of the leading causes of death, we're talking about young people too.
That's exactly right. Yes, it is. So that's why we're working cohesively with everybody to bring awareness to this issue, because it is so deadly, and every Idahoan is at risk, unlike any drug we've ever seen.
What else are you seeing on the ground? So you mentioned the increase in seizures. What else are you seeing?
So we're seeing more users. We're seeing more deaths, of course, because there are more users. As our U.S. Attorney shared, 60% of doses are lethal doses. That's really scary, because they're literally rolling the dice with their life every time they do it.
That doesn't mean that 60% of people who use at any given time are going to die. It just means that there's the potential there for that overdose.
That's correct. 6 out of 10 doses are considered lethal doses.
Do the people you arrest understand how lethal and prevalent fentanyl is? In other words, are they aware of the risk, or is there still a lot of ignorance around it?
Well, we believe that most people that are using fentanyl, at least first-time users, don't even know they're using it. That's what makes it so lethal. They think they're using something else. And the people that are providing this illegal drug into our society are very good at masking it. That's why it looks like pills. It looks like a pill that you should take for anything else, and that's why every Idahoan is at risk.
So in other words, a user may think that they are taking a hydrocodone or an OxyContin that they don't have a prescription for, that they obtained illegally, and that is laced with fentanyl.
That's correct, or even marijuana could be. Any drug could be laced with fentanyl.
Governor Little launched Operation Esto Perpetua last year to combat fentanyl. Is it effective so far?
Well, we're seeing as I shared, our seizures are increasing. We saw the Governor Little proposed and the legislature approved additional manpower for the state police, and so our domestic highway enforcement team will be up and running shortly. We were doing these cases before, but we'll be doing them in greater numbers now, so we think that will help. But enforcement is only one component of this. We've got to focus on the education, so we're outreaching to anybody that'll listen. State police detectives are meeting with them, along with folks from our U.S. Attorney's Office, to try and educate people on this. It was said, when I went around with Governor Little and we had public meetings on this, the comment was made, I think in every meeting, we cannot arrest our way out of this situation. So we're looking at education, enforcement of course, but education, as well as treatment programs, and what does that look like to get people the help they need to get them well.
What does that education look like, and are your folks in places like public libraries and shelters, as opposed to I don't want to say just ad campaigns, because those are effective and have large outreach, but where are you educating people?
Yeah, so I think in general, when you talk about prevention and awareness, it's a all hands on deck, everything type of approach. So my attorneys, my colleagues at my office, we're traveling throughout the state with ISP and other partners to get into schools, town halls, community meetings. The other part of this that's really important is education of first responders, coroners, elected officials. It's still surprising to me when I talk to policymakers who may not understand the significance of this threat. So that's obviously part of this, to making sure that everyone has accurate information to understand what's actually happening out there. So it's everything and everything, and everything and anything.
Let's talk about the importance of working with those first responders and elected officials, because Idaho has 44 sheriffs, we have 44 coroners, and they might approach an overdose scene differently in all 44 of those counties. How does that affect your work?
So what we try to do is work with all of our partners, our city counterparts, our county counterparts, our federal counterparts, and help everybody understand, and specifically with the first responders. We have a really great U.S. attorney in Idaho who's aggressively enforcing what we call LEND bias laws at the federal level. That's going after the users when there's an overdose death. Going after the dealers when there's an overdose death. But in order to do that, there's some evidence we have to capture at the very first of this. So we're working with coroners, firefighters, EMTs, all first responders to help understand. We need to get this evidence so that we can look down the road at a successful prosecution. And so it's a matter of getting that word out to everybody.
And let's talk about your office's philosophy and approach to those prosecutions. And so you do target just dealers, or do you also target some users in those prosecutions?
We generally do not prosecute drug users. Now, many dealers are also users, so with that clarification, our approach is to attack the supply of fentanyl. And the Department of Justice, of which my office is a part, is looking at this as a global supply chain that we're trying to disrupt. So recently there's been prosecutions of companies and individuals in China who are manufacturing the precursor chemicals or diverting the precursor chemicals to Mexico, where the cartels are turning those chemicals into fentanyl pills or fentanyl powder and then smuggling it into the United States. So the department is taking a global approach to this and having some real success in trying to block the precursor chemicals from even getting to Mexico in the first place, and then working with our Mexican counterparts to prosecute individuals associated with the cartels. And then when you get to Idaho, we try to work our way up the chain. So that's why we prosecute dealers, so that we can hopefully maybe flip them and learn where their source of supply is. Usually it's out of state. And then we can work with our partners, generally in the southwest border districts, to attack those distribution networks at the highest levels.
Is that philosophy consistent across districts, administration down? Do you talk to other district attorneys about this?
Yeah, absolutely. I work closely with my colleagues in this, we call them the southwest border districts, so California, New Mexico, Arizona, Texas. And there are a lot of great task forces that are located down there, but we are constantly working with them to make sure that any case that we generate here that leads to a large source of supply, if there's a connection with one of those states in one of those districts federally, that they're able to take the next steps.
And speaking of the Southwest, Governor Little recently deployed ISP troopers to the Texas-Mexico border for Operation Esta Perpetua. What did those troopers bring back with them as far as knowledge and techniques?
Yeah, so we, a couple of years ago, we sent troopers down to the Arizona border and learned some of the techniques. We sent our domestic highway enforcement troopers, so those that are working these kinds of cases, and learned some of the techniques and how Arizona Department of Public Safety was working. This year we went in support of Operation Lone Star, which is Texas Department of Public Safety. And we sent two groups down there. We sent a group of tactical operators, and their role was in a different, near El Paso, but their role was to look for those people that are illegally crossing the border. Then the other group that we took were our domestic highway enforcement folks near Brownsville, and so they had two very different missions, two very different experiences. But what they brought back is the cohesive ability to see and to share with all of our law enforcement counterparts in Idaho what they're seeing at the border, the smuggling techniques, how they're bringing it across, how much they're bringing it across, all these kinds of things, which has been very, very helpful. So we were there kind of in a twofold mission, really to support Texas, certainly with the border crisis, but also to bring back that information. And now we're hosting trainings for all law enforcement in Idaho, kind of a train the trainer concept for those troopers who did go down to the border to see what's going on there and to help them come back, and so we can be more effective at keeping this out of Idaho.
We knew that Idaho State Police has had an employee shortage for a while, wanting to get more full-time positions in your office, out on the streets and out on the highways. Was that an effective use of resources? Are you seeing that pay off?
Yeah, we're seeing it. It was very effective because of the information that I don't think you can glean any other way other than seeing it right there and being part of that experience, to come back and be able to use that information and to be able to use that knowledge here. We send our people to training all the time, all over the place, to become better trained at their jobs, just like any job does. And this was probably some of the best training we could have possibly sent these troopers to.
We talked earlier about how a lot of users don't realize that they're even taking fentanyl in the first place. They think that they are consuming marijuana or hydrocodone. We know that students at University of Idaho are currently lobbying or launching an effort to make fentanyl test strips legal in Idaho so users can better understand their risk and know exactly what they're taking. Right now it's classified as drug paraphernalia and is not legal here. Where do you stand on fentanyl test strips?
So my position on any kind of drug is we have a great place that's foolproof right now of how we can do that, and that is not to take any drug that's not issued by a prescription by a physician. That's really the only foolproof method. I know that there's a push for these other things, but the reality of it is all of those have flaws. The only foolproof method is to get it from a healthcare provider.
But the reality is counter to that there are still drug users who are going to buy and obtain and consume these drugs. From a harm reduction standpoint, is this something that might prevent some of those overdose deaths?
We think that we're better off to provide the education of what this does to society and what this does to individuals.
Another harm reduction strategy is providing Narcan, which is a nasal spray that can effectively reverse an overdose in process. This last session, Idaho lawmakers voted to limit who could receive free Narcan kits from a grant. They limited that to first responders as opposed to family members or friends of people who are addicted to opioids or users themselves. And these kits are expensive, making some doctors hesitant to prescribe it. Do you see Narcan availability as a barrier to reducing these deaths?
So the availability of Narcan for first responders was not impacted. I think it's important that our legislative partners, they understand our legislature was very clear in that, to make sure that this was a tool for first responders, because that's where it's getting used the most. And that's who generally is going to use it first. But Narcan is not foolproof either. And the fallacy in that concept, in that thought is, if I take this drug, there's something that can save me. There's so many factors in that, timing being one of them, having it administered at the right time, having it administered correctly, all those issues. So first responders are trained in how to administer it. And so we think that the safest thing to do is to make sure that we need Narcan, and we've had a lot of saves. We've also had instances. We had one instance over in eastern Idaho where one of our troopers, the woman was passed out in a car and got to her too late and could not save her, and did CPR and wasn't able to save her. So Narcan is absolutely not foolproof. It is a last-ditch resort. But there's all these other things, education, treatment, and all these other things I think we should focus on before we get to the last-ditch effort.
When you say that Narcan is most commonly administered by first responders, is that kind of a chicken and an egg thing? Because they're the ones who have the most access to it in the first place, as opposed to people who are in the household with the users, like their family members or friends.
Well, I think part of the issue with Narcan is that, like I shared, that's the last-ditch effort. So I think that's not going to solve the problem. What we need to do is we really need to get these people the help they need. And so we're focused also on treatment, to get them the treatment they need to get out of this. Narcan does nothing to treat the problem.
Does the administration have a stance on Narcan availability?
Generally, we're supportive of Narcan availability. I'm not commenting on state legislation at all. But I agree with the Colonel. Narcan isn't something that's foolproof. It's not a solution to the problem. When it's used effectively and saves lives, that's a great thing. So I think that's reflected in the administration's position. But people shouldn't think that this is like the drug problem we had 20 years ago. I'll date myself, when I was in college, right? In terms of going out and experimenting, that was always kind of a distinguishing line between those who experimented with drugs, used drugs casually, and then those who were addicted or had substance abuse problems. That really doesn't apply now because of fentanyl, because one experiment, like we talked about, is like playing Russian roulette. And so Narcan's certainly an important part of the conversation, but we also need to recognize that it's not going to get us out of this crisis.
Are there any other strategies that can reduce the risk that we haven't talked about yet?
So, one thing I would focus on from the prosecution standpoint is we've seen cases and lend bias or death resulting cases in urban settings, in rural areas, in all regions of our state.
And that means targeting the dealer instead
Correct.
of the user specifically.
Right. So a death resulting case is when we charge someone with making a distribution of fentanyl that results in a death, that causes the death. That has a heightened penalty under the federal system. And what's good about the penalty, apart from individual justice in that case, is that it allows us to usually get dealers to cooperate with us to explain where the source of supply is, which helps us get these drugs off the streets. So that's why we use this particular statute so aggressively. But I think all Idahoans need to understand that this can affect you no matter where you live, no matter what your characteristics, no matter your socioeconomic status. We've seen really wealthy people succumb. We've seen obviously people without money succumb. So I think it is just different than what we saw with meth, which was limited based on its availability in certain areas of the state. Fentanyl, because it's, like I said, so small and so lethal, really impacts every single community up and down in Idaho.
Any other strategies that you want to touch on that you'd like to see implemented?
Well, we're focusing just really the threefold. We're focusing on the education piece, we're focusing on enforcement, but we're also focusing on treatment. And we have a pilot program right now at Kootenai County with the Kootenai County prosecutor. And I'd like to say that while we have a great U.S. attorney for federal cases, we have fantastic county prosecutors for state cases that are working in concert with us, and we're working with them as well. And so this pilot project we have in Kootenai County is if they're first-time offenders and they're arrested as first-time users, not dealers, but users, and they're willing to get treatment right then, they go into treatment right then. And so we recognize that enforcement is not the only tool, it is a tool, but we've got to look at all the tools we have to be successful here. Because as I said at the beginning, this is every Idahoan's problem, unlike any other drug we've ever seen.
And when you say treatment, is that through the traditional drug courts? Is that, where are they getting the treatment?
So we have treatment facilities. In Kootenai County, in this pilot program specifically, we have treatment facilities already set up to take them in right then. From the traffic stop to a treatment facility. It's that fast.
Idaho State Police Colonel Kedrick Wills, U.S. Attorney for Idaho Josh Hurwitt, thank you so much for joining us.
Thank you.
Thanks for having me.